Alberni.
Thank you, Madam Speaker, and I'm really glad we're here to talk about the mental health emergency that's taking place here. And you know, on October 5th, I had asked the Speaker if we could have an emergency debate, and I wasn't granted permission to do that, Madam Speaker. So I'm grateful that all parties have come together to have this important conversation. Madam Speaker, I'm going to read a quote from Ellen Cohen and Kim Holohan. They're from the Canadian Alliance on Mental Illness and Mental Health, CAMI. And they state that mental health is an integral part of health, and Canada cannot pride itself on a universal health care system that does not include universal mental health care. That the development of national standards for mental health and substance use services cannot delay the introduction of the Canada Mental Health Transfer. Instead, these standards must go hand in hand with the creation of the mental health transfer, rather than the sequential approach that the government is currently taking. So my question, Madam Speaker, is since 65 national health organizations sent an open letter to the minister saying that the time is now for the government to fulfill its campaign promise, will the minister finally listen and help deliver the help that Canadians desperately need and deliver on the transfer?
Honourable Minister.
I thank the member for his amazing work on this, and I think that one of the reasons we wanted to have this debate tonight is because of the fact that if when his party it didn't meet the criteria for emergency debate, because opposition days can do that, that we decided that we would make sure that that debate took place. And I thank the member for his initiative and really all the hard work. I have met with the CAMI members the morning of the gala, and when our colleague Mike Lake received an award.
Yes. Edmonton, well, it's quite a different, a member from Alberta. Let's put it that way.
Thank you, Madam Speaker. That it is. I walked them through what we needed to do, and I think a lot of them understand how we have to put in place the kind of transparency and accountability to Canadians, like in the childcare arrangements. I think that this is something that we all will be able to work on together, but that won't stop us delivering the kinds of programs that we are doing in substance use and mental health and innovation, the kinds of programs, as well as within the bilateral agreements, the $600 million a year that is ongoing. So we will work as quickly as we can to just put in place the principles for that transfer, and then get on and negotiate them with the provinces and territories to ensure that the data comes back and that there is transparency and accountability for all Canadians.